Well, since the pandemic hit Canada's health sectors hard, there have been a lot of questions about how do we help a system that is in crisis. Our next guest has a few ideas. Dr. Michael Rackless spent years as a family doctor, a healthcare advocate. He's now an adjunct professor at the Deluce School of Public Health at the University of Toronto. Welcome to Your Morning, Dr. Rackless.
Good morning, Anne-Marie.
The federal government has offered the provinces and territories this new health funding deal to the tune of $196 billion over 10 years. The premiers say that still isn't enough. So if that isn't enough, what will it take?
I think that there, of course, is a lot of posturing. The provinces will say it's never enough, and that there's no question we do need some money. But there's a lot of things that we can do in our healthcare system to make it better, which wouldn't cost a lot of money.
And what would those be?
Of course, one of the quick things is that things that we've already done. There's thousands of people who aren't being treated for lung cancer this year, and tens of thousands who aren't being treated for heart disease or stroke, because those diseases are becoming less common on an age-adjusted basis. So that would be the first thing, but there's a lot of other things that we can do as well to make the system run more smoothly once people do get sick.
But like you, we've been looking for answers to this healthcare crisis. We've had different guests on, over the last few months. One of them was a nurse practitioner who came on the show, and she believes that more NP-run clinics could be the answer. What's your take?
There's no question we should do better with primary health care. And better use of non-physicians is a good thing, because roughly 50% of visits to family doctors could be done as well or better by someone else. However, the key thing is you need to get people working together in teams. You can't have somebody going to a standalone nurse practitioner. That's the way nurse practitioner clinics run. They tend to be interdisciplinary. But there's no point in just having, standalone pharmacists, doctors, nurses, etc. We need to get people into proper teams, and not a team where you say, oh yeah, I work with an addiction specialist 60 kilometers away, I've never met him, blah, blah, blah. No, you've got to have small so-called micro teams of maybe 5 people or so that can provide, let's say, 90% of the care that people need. And that would include not just a physician and a nurse practitioner, but also you need to have social workers or mental health practitioners on every team. 10 to 20% of people are going to primary care for mental health issues. So, and another 10 to 20% at least may have primarily a physical problem, but it affects their physical illness. So we need to look at small interdisciplinary primary care teams that are responsible for, let's say, 1,500 patients or so, and that can be the base of our system.
And one of the other places we've looked is to other countries. What about phasing out a fee-for-service for doctors, instead instituting a salary, similar to what the UK has?
And there's no question that we should be looking at that. It's not new. I worked as a salaried family physician in a Toronto community health center over 40 years ago, on a team with a nurse practitioner and a nurse. The question really is, why is it taking so long for this to happen? And one of the big reasons people forget now, because I think most doctors are in favor of Medicare, the medical profession fought against all the Medicare legislation, including the Canada Health Act in the 1980s, fought against the better use of nurse practitioners and midwives and other practitioners. So that, the original deal with Medicare in Saskatchewan, first proposed by Tommy Douglas around 1960, was that the doctors would be on salary and working in teams. So interestingly, it's physicians who really fought all of that for decades. And now I think most physicians sort of blame the government because they don't have a salary and they're not working in a team.
We could talk a lot more about this, and we will have future conversations because we still haven't found the solution. Dr. Rackless, thanks for coming on this morning.
You're very welcome, Anne-Marie.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.